Okay, welcome to this next video. The previous one talked about showing and selling. Now we're going to talk about the actual willingness to show dentistry. So that's what we're talking about. Are you willing to show patients exactly what is going on? In order to do that, let's go ahead and ask this question. What is quality dental care? Because if you can't deliver quality dental care, then I can definitely see how that would be a block to somebody not feeling right about prescribing treatment to somebody if they don't know how to deliver it in a quality level. And so if you know you're doing quality work, then there shouldn't be an issue here. But let's go ahead and define real simply what is quality dental work. Something like looks good, feels good, lasts a long time. I think that's the criteria that a vast majority of our patients are going to use. I would not rely upon the things you see on Instagram or what you see in the textbooks and these different things where you see this really exquisite dental dental work that's done, but the thing is, in order to achieve that very pretty example you can take a picture of and show your colleagues would require a lot of extra time, and it simply doesn't work for most of our financial models to do that. And by the way, I don't really think patients care about how good their second molar filling looks. But you do, of course, want to focus on getting a good quality product, and that is what you're always striving towards in practice, is always trying to get better and better. But if you could just meet this criteria, and if you could say, yeah, I do work that looks good, feels good, and lasts a long time, then I think you can check the box and say, yes, you are doing quality work, which should give you the confidence then to move forward with any treatment recommendations that you might want to give to your patients. Okay, next thing, let's talk about this. It's called the My Job, Your Job script. Now, I got this from Greg Stanley from Whitehall Management. He had a lot of great information. He really helped influence my way of thinking about practice and doing practice and so forth. He unfortunately passed away here in 2024, but he was just a fantastic mentor of mine. Anyhow, the My Job, Your Job script. It goes something like this. In your own words, you would say something like this to the patient somewhere along the way in the new patient exam process. You say, my job is to evaluate your teeth and gums. If I see anything, I'll let you know what it is and options to fix it. My approach is to assume that you want the best. Again, if there's any options, we can discuss those as well. Okay? Put that in your own words. You can see some of the key items here. You're going to be examining their teeth. You're going to tell them what you're seeing. You're going to make recommendations. You're going to let them know options. Okay? It's very simple. Basically 4 parts to that script that you would say to a new patient so they kind of understand where you're coming from. Now, what is the benefit of doing this doctor's job or your job script? It allows the doc, the permission, I've underlined permission, the permission to put together an ideal comprehensive treatment plan. Now that might seem kind of weird, like what do you mean permission? No one needs to give me permission to put together a treatment plan. There's some hang-ups, and we'll get to those in a slide coming up here in a moment, that may prevent you from actually showing everything that you need to show. So with this script, you're able to then deliver to the patient your idea of what you're going to be doing, and it gives you the chance to breathe, mentally breathe, and tell everybody what they need without trying to separate patients, this one versus that one. You can just treat everybody the same, and you can go all in, letting them know that they have options. Okay? Now, my job, your job, their job, the patient's job, okay, is, again, this is a script in your own words given to the patient. Say your job is to ask questions so that you, the patient, are clear on the situation. And then as far as treatment options are concerned, you can choose to do some of it, all of it, none of it. It's up to them. Okay, what you're doing is you're giving them, again, the independence to decide, and they too get permission. Permission, again, to do nothing, to do something, to do everything. It's up to them to decide. And going forward, that means there's no awkwardness. Let's say you've laid out this big treatment plan, and they only did a couple of things. Do you think the patient might be concerned that you might be slightly disappointed in them, that they didn't go ahead and follow the rest of your recommendations? Well, if you give them this script, now it just kind of relieves the pressure. There is no pressure for the patient to get 100% on board with your plan. They can choose to do that or not. You've given them the permission to do so. So the My Job, Your Job script allows both parties to have the permission to move forward kind of completely however they feel they need to. Okay? So now let's take those 2 things we talked about earlier, the quality component, and now these permission statements. You put those together, there should be no hang-ups about you from showing complete comprehensive treatment. And this applies to your staff as well. Actually, during a staff meeting, I sent out to all the staff and said, listen, let's go back to that quality question for a moment. If I give you that criteria. Looks good, feels good, lasts a long time. I want you to write down a piece of paper your answer. Do we, at our office, do we deliver that kind of care? Do we meet that simple criteria? Write it down and fold it, and we're going to put it in this box, and at the end I'm going to go through and sort to kind of see how many yeses and nos. Of course, we got 100% yeses. So that means all the staff should be on board with feeling good about what we're actually doing for our patients. And again, we've given the patients permission to pick whatever they want, and there's no hard feelings either way. Then that makes the patient a friend of the practice, and moving forward, we'll do as much or as little as they want. Now, I talked about hang-ups that you might have. Your staff might have, and you as the dentist, you may even have some hang-ups. Let me go over a few of these things that I've witnessed within myself and things I've even seen within my own office and even talking to other doctors. How about this one? You're concerned that you may overwhelm the patient. You put together this treatment plan of ortho and removing wisdom teeth and veneers and crowns and maybe replacing a missing tooth with an implant. You have all this stuff and it comes out to be quite a bit, and you're afraid that you just might overwhelm the patient, so you hold back. You just tell them what they, quote, need, the urgent stuff, but you don't address anything beyond that. How about the patients? They said when they made their appointment, they just want their teeth cleaned, they're having no concerns, and now all of a sudden you're coming up with a treatment plan that's thousands of dollars. Don't you think that might be maybe a little bit concerned that could be off-putting to a patient? Whoops, there we go. How about worried you might get the reputation that you're just about the money? You put together these treatment plans and you're afraid patients may leave, talk to their spouse, talk to their coworkers, maybe even go on Google, say, watch out for this place, they're all about the money. Are you concerned about that and therefore holding back showing patients a treatment plan that is most ideal for them? How about it seems like a lot of money compared to your own financial situation? Now, I'm assuming for dentists, you probably can afford dentistry, but your staff, your treatment plan coordinators, your assistants, your hygienists, if you're looking at a treatment plan that's thousands and thousands of dollars, given the price of, the wage level that they're at, they probably would see that being beyond the scope of what they can do financially. So you can't layer whatever your financial condition is on top of a patient and assume, well, that seems like a lot of money, and therefore feel bad or weird or just reluctant to want to show patients the actual dental work that they need, or at least the options that they have. How about you just want the patient's approval, or at least you don't want to upset them? It's kind of like, not wanting to overwhelm them. You don't want to upset them. I mean, they came in with this kind of whatever we call feel at times, a vibe, from a patient. Like, whoa, I don't want to make this person upset, and so you hold back on actually showing them what they want out of fear of that. Or how about you're trying to gauge the patient's financial situation? You're just trying to dial back the treatment, but you are estimating what their ability to pay is. And so you show them options or a lack of options because you're kind of guessing. You're kind of diagnosing their pocketbook, as they say. Absolutely no place that needs to be when your mindset when you're trying to go through it. And again, for your staff as well. Or how about asking for a decision just kind of feels like pressure? I actually had a staff person who, a lot of times we try to work in same-day treatment, and so what we want to do is, for efficiency reasons, we want to get the room kind of set up while the patient's still in the room, so that when they go back when the front desk comes back and goes over the financial agreement and the patient knows what the price is and the patient says, yes, I'm ready to go. Well, I'd like to have the room already set up so we can just, get going. I mean, the patient's time is valuable. We don't want to spend our time wasting our time now setting up the room after the patient has already said yes. I had a staff person actually say that she didn't want to start setting up the room ahead of time because, it might kind of pressure the patient into kind of saying yes, and she just didn't really feel right about it. See, I was looking at it from a purely efficiency standpoint, and she was seeing it from a more of I'm going to call it a hang-up she had about the patient and what her feelings were in regards to moving forward with treatment. So to wrap up this video, I'd have to just say you have a duty to inform your patients. You are the doctor. You are the one that went to school. You're the one that they're putting their trust in your hands, quite literally, in your hands, to deliver quality care. But they also want to know the plan, and they want to hear from you, the good, the bad, the ugly. They want to hear it from you, okay? They may be in denial. They may have anxiety about the money or time or cost or, the pain or whatever it might be. That's kind of their problem, so to speak. That should not prevent you as a doctor from carrying out the duty that you have, the obligation you have to show your patients the best and then work with them on whatever options that they may have and then going forward with whatever it is that they choose. So again, quality work, my job, your job, inform your patients. I think you're going to end up doing really well. You're going to be able to show more, which is then going to equal you actually selling more and actually getting patients to be healthier than where they are currently. All right. Thank you.